There are two types of Hispanic people living with HIV. The ones that migrate to U.S. and the ones that born and raised in U.S. In my experience, I have like both because in Puerto Rico we are U.S. citizens, but when you travel, you experience what an immigrant experience in U.S. Because it doesn't matter if you speak English or not. It doesn't matter if you're born and raised there. You're still a Hispanic and you don't belong. I was diagnosed on 2003. And I thought by that time that I was gonna die. That was like a death sentence, especially because the medications were not as good as they are right now. And you notice how the people start treating you differently. And that is the root of the stigma, how you feel that you're treated. It doesn't matter if they said that they are not treated in certain way, you feel it. I think that the stigma was so strong inside me that for at least 10 years, I was living inside of the closet of the HIV. I avoided everything related to HIV. I started working in the HIV area in 1999. So I identify myself as a service provider and not a person living with HIV. I talk like for years, bringing workshops and all that stuff and how to, live with HIV, but things that I didn't apply to myself because I was all the time worried about rejection specifically. Every time that I try to have a relationship with someone that I met, they reject me, and that gave me like the reason, like that's why you need to keep hiding. My mom was the one that talked to me, not me to her, and I remember that was I think in 2016. So I was diagnosed in 2003, so 13 years later, she was the one that sat down in the bed and told me like, oh, I start getting emotional. Okay, she sat down on bed and she told me like, I want to talk about you something. And I want to don't get mad at me, but I know that you are HIV positive. And I always gonna love you because you're my son. And I started crying and crying and crying, and she was the one that was strong enough to support me. I was already an advocate. I was already outside in US, but not in my country. So my mom was the one that had the courage to get me out of the closet just to support me and show me how much she loved me. Muchos de los retos que las comunidades latinas experimentamos a la hora de recibir servicios en los Estados Unidos es el idioma. No importa si el documento está en español y lo entendiste, te tienes que comunicar con una persona a la hora de llegar a una oficina a recibir un servicio. Y no necesariamente vas a encontrarte con personas que hablen español al momento. Y si alguien habla español, muchas veces es un español diferente al tuyo o es un español que no es su primer idioma tampoco. Entonces, eso crea ya una de las primeras barreras, el idioma. La segunda barrera, el entendimiento, el que tú entiendes, que ahí es donde viene el concepto de health literacy, en donde no necesariamente las personas entienden completamente lo que los proveedores de servicios le están diciendo. Y a los servicios ser un continuo, una vez tú buscas el servicio, tú vas a una oficina, recibes el servicio, tienes que ir a lo mejor a otra oficina hablando en términos de servicios para VIH, recibir medicamentos, ir a case management o manejo de casos, trabajo social, etcétera, o todos los demás servicios. cada uno de ellos va a ser de nuevo otro reto para recibirlos en tu idioma. Y aunque te puedas expresar en inglés, a lo mejor no es tu primer idioma o no lo dominas tan bien aunque lleves varios años viviendo en Estados Unidos. Y eso también causa una brecha o un espacio en la comunicación. I think that I'm that kind of person that likes to share knowledge. And I think that knowledge is power. It took me for me get to the PhD to learn how to interpret some of the statistics and the charts. How this information is not going down to the communities that were the ones that provide you the information to build the research. So what keeps me going is to be that bridge, that link between the community and the academy. I need to simplify things for the communities to understand it. And also because there's a lot of things that I lived that I want others to. It will not prevent them to live it, but at least I can provide a little bit of tools how to overcome difficult times, specifically talking about stigma. And I want others to have the same knowledge that I have, maybe more, but receive it in a way that is easy to digest and easy to understand. And I want to be that link to continue helping my communities in other areas,